It's always important to prepare right for any surgery, especially laparoscopic endometriosis excision surgery. So I'm going to share how I prepared for my endometriosis excision surgery. The video after this will be about what to expect after surgery. But first, here's the preparation part. I believe preparation needs to begin as early as possible because I found that doctors don't give us, patients, enough of a plan. So based on my experience, I've put together a list of tips that worked for me. Please note that I'm not a medical professional. It's always best to consult your doctor before you apply any of the following tips I'm going to share. Oh, and please also note that I don't have just endometriosis. I also have Ehlers-Danlos syndrome, fibromyalgia, chronic fatigue syndrome, arthritis, MCAS, and painful bladder syndrome, all to consider. You may have other medical concerns that may need addressing. So again, please seek your doctor's advice. Now, with all those disclaimers, very important cautions out the way, here is my guide, how to prepare for endometriosis laparoscopic excision surgery. My excision surgery took place in September 2019 in New York. When I started my preparation, I didn't have a date or a surgeon in mind, but I knew that I desperately needed to get the surgery done, a decision I took 2 years before my surgery. My endo pains were horrendous, and my Ehlers-Danlos syndrome EDS pains weren't too kind either, so I needed to address at least one painful condition, and my only treatment option was surgery. I have a list of 4 main tips, and I will speak of each tip in great detail. If you wish to skip to any of the other details, then I have noted timestamps for each of the tips so that you can move through the video faster. That's in case if you wish to. I actually wouldn't advise you doing that because it's all very helpful information, which I wish was easily available when I was planning my surgery. But okay, here goes. Tip number 1, adopting an endometriosis and Ehlers-Danlos syndrome friendly diet. Like I said, I knew I needed surgery, but I didn't know when that would happen. So very early on in my desire to have surgery, I started making changes to my diet. I actually made 6 changes to my diet. I've done a detailed video about this, which I will link in the description box, and hopefully I'll add a link on this video as well if I remember. But just to give you a gist of what I did, I managed to work towards a more anti-inflammatory diet, which meant going gluten-free, dairy-free, and a few other changes. To know more, I would suggest that you watch that video. A lot of thought and effort has gone into explaining the reasoning behind each of the 6 changes, so please check that out. Tip number 2, strengthening the abdomen. As mentioned before, I have EDS, which keeps my exercising limited because even the slightest error can cause a flare-up, which can really set me back, forcing me to rest up. For example, an error cost me rib slippage. Yep, that happened, and it not only hurts, it made it very uncomfortable to sit or sleep. I actually faced many such roadblocks on my way to improving my abdomen strength. So here is what I figured out under the guidance of my physiotherapist. I'd request you to please also do the same. I did aqua therapy, pelvic floor therapy, resistant band work, and timed walking. Let's look at all these therapies, just so that I can explain it better and their benefits better as well. So first, aquatherapy, as the name suggests, it's therapy in water. Now, exercising in water not just relaxes the muscles, but your endurance improves. So does your range of motion, joint stability, and most importantly, you only feel 20% of your body weight. That way, you're not adding your body load to your joints and are able to carry out your exercises for longer. The same movement outside the water would tire me out, cause me pain, and set me back a week at a time. So aquatherapy was a much needed addition. Plus with EDS and my POTS episodes, which would cause me to feel dizzy and fall, water was a safer place as the aqua cubicle had like handlebars to hold on to, and my therapist was there to make sure I was carrying out the exercises correctly. The drawback at the time was I had been bleeding way too often, and doing aquatherapy on periods isn't a great idea and isn't allowed. So I wish I could have done this more regularly, but it wasn't meant to be. But I would recommend it for sure. The next therapy, pelvic floor therapy. It's a form of strengthening exercise in which I was made to isolate specific muscles by applying focus in order to move and hold those specific muscles. This therapy is to help those with pelvic muscles. Well, we all have pelvic muscles, but for those of us who have weak, tight, and have gone through trauma, surgery, and even those that endure pelvic pain during intercourse, or issues with incontinence of urine or feces. I started pelvic floor therapy a little late, but it aided in slowly strengthening my abdomen muscles without any aggressive movements. This has also been recommended as post-surgery therapy too. The third way in which I helped myself are through resistance bands. These bands are used for strength training and stretching. I mainly use these bands for upper body strength under the guidance of my physiotherapist. We worked out my problem areas and I was given a specific exercise program. Plus, I feel once an expert teaches you about form and positioning while using this band, you're giving yourself a better chance to improve your strength and a lesser chance of injuring yourself. Now, the last on my exercise list, and also the most simplest, is timed walking. On days when I wasn't well enough or was not scheduled to do the 3 strength training options I spoke of, I made sure I walked. I have EDS, which affects my legs greatly, so my easiest flare-up area has to be my legs. I use walking sticks to aid my balance and improve my footing, but when I do my walks, I prefer to do them at home in a controlled environment. So why is my walking timed, in case you're wondering? Well, after experiencing a wheelchair because of EDS, every minute that I walk, even if it is with help of walking sticks, I find it to be an achievement. So timing my walk allowed me to see the growth in the length of time that I could walk, and importantly, it made me watchful enough that I don't overdo it, because walking more than I should only leads to flare-ups and me not being able to do any exercises for a few days, and that obviously isn't great when you're on a pre-surgery strength training mission. Okay, so diet in place and exercise too. Tip number 3 is all about how to prepare a few weeks before surgery. And a few weeks before surgery, shopping is an absolute necessity. I realized that after surgery, my abdomen would probably be sore and bloated, yet I was told by my surgeon that I would need to start moving around and walk the day after surgery. So I shopped and organized the following things. So number 1 was loose clothes. I shopped for loose t-shirts, track pants, pajamas, anything loose that I could find. Number 2 was sanitary products. I bought period underwear, which is great for light bleeding post-surgery, and organic nighttime sanitary pads. Number 3, extra pillows. So in case you don't have them, you'll need to shop for them. So these pillows ended up being placed near and under my sides, hip, waist region to help me prop myself up after surgery. So to sit up, you need to use your core strength, and it is mighty painful after surgery. So the extra pillows help. There is no way I would have moved had those pillows not been there. Number 4, stock up on foods. I wanted to make sure that I followed my endo-friendly anti-inflammatory diet post-surgery, so I made a list of all the meals I would like to have and the vegetables I would need for it. Number 5, medicines. Your doctor will give you a list of medicines that you will need before surgery for your bowel prep and uterus prep, and also some meds for post-surgery as well. It's always best to buy these beforehand so that you don't rush for these things last minute. Now, on to my fourth and final tip, which is a few days before surgery. There are some things that can only be done a few days before surgery, and I created a checklist for myself, and here it is. Number 1, reorganizing my wardrobe. All my loose clothing needed post-surgery was placed as the first thing you see when you open my wardrobe, so that anyone at home trying to help me will be able to understand where and how the clothes are kept. Number 2, organizing my bedside table. I organized the table next to my bed, which had my medication, some nuts to munch on, my earphones, laptop, a book, and my phone charger was set in the plug point near my bed. Number 3, meal prepping. Some of my meals needed preparation. With the help of family, we were able to have certain meals in place, such as soups and lentils. Number 4, hospital bag. I set up my hospital bag 2 days before surgery, in which I carried an extra change of clothes, especially something to keep me warm in, and also my doctor's notes. I had to do this 2 days before because the day before surgery was bowel prep day, and it's very difficult to get stuff done that day. Number 5, keep everything charged. I didn't want to struggle to charge my phone and laptop with stitches hurting, so I made sure everything was charged. Number 6, I found this really important, taking time out. Before my bowel prep, which like I said happens a day before surgery, I took time out with my family. We walked around, visited cafes, went for drives, and just chatted around the dining table. This surgery is major and overwhelming. Your surgeon won't really know what will be found until the actual surgery isn't happening. So you're diving into the unknown in the hope you will be relieved of endometriosis pain that you faced for possibly decades like me. So please take time out to feel normal with those you love. And I'm extremely grateful for my family, who have been immensely supportive with everything I have been through. They've helped to keep my humor alive, and so spending time with them in the days leading up to surgery helped to calm my nerves and my excitement. Number 7, bowel and uterus prep a day before surgery. It's important that the bowels are clear for surgery, therefore you should be advised a drink that will help you do this. I was also given a tablet to insert in the uterus that is supposed to relax the uterus for the surgery. Number 8, self-care. My surgeon didn't allow any nail varnish, so that was removed. After surgery, you are advised to not bend for at least 6 weeks. So I made sure I cut my nails, especially my toenails. A day before surgery, I applied a face pack, had a nice long shower where I washed my hair, did a nice long body scrub, and just spent time relaxing under some warm water to help ease any stresses. My room was cleaned up and the bed sheets got changed so that when I got back from surgery, everything is nice and fresh. Number 9, cushion and footstool in the car. I had read that after discharge, the ride back home will hurt, obviously. It was advised to keep a cushion on the stomach and then put the seatbelt on top. Now, this reduces the impact and helps to avoid unnecessary pain. So please keep a cushion in the car beforehand. Another good tip was a footstool. I traveled in an SUV and I knew that climbing into it, despite making the car kneel, would have been too much for me. So we kept a footstool to reduce the pressure the abdomen would go through. These All may seem like small things, but after surgery, you will realize what a difference these small things will make. And I'm glad that with all the family help, I managed to get this done. Overall, everything mentioned here made a difference to how I felt going into surgery. I felt mentally and physically well focused and well prepared. If you believe any other forms of preparation helped you, please do share in the comments below. If you know someone that would find this video helpful, then please forward this to that someone. Please like, share, and subscribe to my channel. Thank you for watching.